There is a line of Ralph Emerson which says, even if one life breathes easy because you are there, my life is worth it.
And a leader should have the quality to make decision at proper time.
అంటే అన్ని పనులు కుమ్ముడు ఇట్లా ఈ పని చేద్దాము అని ముందుకు వచ్చి కలుపుకొని చేసేదే నాయకత్వం.
Leadership is tested best in the crisis time.
If you're a leader, then how you mentor, how you coach, and how you provide and give space to others behind you to then become the future leaders is really important.
What are some of the words or characteristics you associate with good, effective leadership? Inclusive, supportive, powerful, compassionate, and of course, change. These are the 5 words used most often by the best leaders. But leadership for women, in the pandemic years especially, has often remained unsung. COVID has not been gender neutral. Millions of Indian women have had to drop out of the workforce. Even the access to vaccines has remained unequal. And yet, it is women who have led the charge against COVID. Healthcare workers are mostly women. Long-term caregivers are mostly women. But in the health sector, women remain a minority in leadership roles. Today, 5 such women tell us how. IAS officer Srijana Gumala cut short her 6-month maternity leave to return to work with a 22-day-old son in her arms as COVID cases surged in Visakhapatnam. She took a quick decision on her focus areas: sanitation, rations, and drinking water for the poor, and coordinating relief measures with grassroots officials. Every few hours, she would step back from the front line to feed her infant and then go right back to COVID duty. The results showed. In 2021, Andhra Pradesh was ranked among the top 2 states in COVID management.
It has empowered or given me so much mental strength that to think back these days, at the cost of being a little dramatic, I'm really proud of myself. Probably that was the right thing to do at that point in time. Even if one life breathes easy because you are there, my life is worth it. That I adopt on a daily basis. I keep reminding it to myself that today, even if one person gets his life easier because I was there in a certain position, it is all worth taking the effort.
The Guardian called KK Shailaja a rock star health minister in May 2020 when Kerala, a state of 35 million, reported only 4 deaths. Shailaja, a former secondary school science teacher, was already the stuff of folklore. A movie called Virus was inspired by her hands-on, compassionate, and effective handling of the Nipah outbreak. Shailaja grew up watching her grandmother fight untouchability and class wars. So it's no surprise that her approach to COVID was guided by a fierce sense of social justice.
In India, in our constitution, it is written in the preamble itself that without the discrimination about sex or gender or caste or religion, all the citizens are equal. But we have to do something practically to achieve that thing. So I want to say all the women and girls, that be brave and think that we are equal and we have no discrimination of time or place or like that. We can go anywhere we want. We can do activities according to our wish.
Pona Swapna went to every single house in her village during the pandemic to fight vaccine hesitancy. As a young girl, Pona Swapna wanted to be a nurse, but her parents did not allow her to complete a college degree. Instead, they pushed her into marriage at the young age of 19. But later, Pona Swapna went back to her dreams. She became a sarpanch, the only woman in her village to have completed class 10. During the COVID years, she personally met every villager and convinced them to take the shot.
అంటే కోవిడ్ రోజులలో మేము చాలా ఇబ్బంది పడ్డాం మేడం. అంటే భయం, అది ఇట్లా టీవీలలో ఏ రేట్కి ఇట్లా పాజిటివ్ వస్తుందంటే ఎవరైనా భయపడతారు కదా మేడం. అయితే అన్ని బంద్ ఉన్నా కానీ వేరే విలేజ్కి వెళ్ళి ఇట్లా షాపులు తెరించి మరి బట్ట తీసుకొని వచ్చి వేరే వాళ్ళు మా విలేజ్లోనే ఒక 6-7 మిషన్ కుట్టే వాళ్ళు ఉన్నారు మేడం. అయితే వాళ్ళతో పాటు మాస్కులు కుట్టించి వాళ్ళు ఇట్లా సేవ లెక్క వాళ్ళు కూడా.
Pragya Yadav at the Indian Council for Medical Research, National Institute of Virology, is among the scientists that detected the first 3 COVID cases in India. She also led the team that helped develop Covaxin, the first indigenous vaccine against the virus. Her team built India's first kit to test antibodies for COVID at a time when only 2 other such kits were available in the world. As a child, Dr. Yadav's inspiration was Marie Curie, the first woman to win the Nobel.
We are great in nursing jobs. So I think we are doing a very, very great job as a country. So it's a very great opportunity for all the girls who wants to pursue whatever they like. If they want to do science or art or media, just follow the dream and find a way to fulfill it. And I think you have a great opportunity now in India, abroad, to work whatever you want to do.
At WomenLift Health, Dr. Shagun Sabharwal makes numbers speak. Speak for equality, empowerment, and emancipation. Why, for instance, are only 25% of leadership positions held by women when they make up 70% of the world's health workforce? Why is only one company in the 27 Fortune 500 of the global health sector led by a woman? Shagun Sabharwal trained to be a clinical psychologist and worked with domestic violence survivors. Now, for 13 years, she has worked on improving gender equality and health in India.
So I was drawn to this broader idea of violence against women or intimate partner violence. Why does it happen? Why is it so common, and why is something not being done about it? And that almost propelled me to looking at other fields where the lens that is being taken is not just an individual lens, but at a more sort of a policy and a more scale lens. So this is what I would also like to say, that, you know, overall, when there are these clear demarcations in terms of, or the stereotypes on what and how women should be and what they should do versus men, it is very important that we create that enabling environment and ecosystem, and have a lot of role models, so that girls in India can also then have careers and sort of grow in those.